Hi, I'm Xavier. I'm about to be a senior in high school, and I wanted to make a video for my capstone project, pretty much explaining my experience with getting open heart surgery as a 15-year-old. Because when I was getting my surgery, obviously I was very scared, and I really had no idea what was going to happen. I mean, I knew how the surgery was supposed to work through talking with the surgeon, but I think if I had someone who had gone through a similar process, uh, kind of give me some recommendations and let me know what to expect and what's not a big a deal as I thought it was going to be, that would have been very reassuring. So I kind of just wanted to do that and try to make a quick, informal video just explaining my experience with heart surgery. So I was born with a birth defect called sinus venosus ASD, and that means there was a hole in one of the quadrants of my heart, which required the rest of my heart to work much harder because blood wasn't getting to the right place. So pretty much the rest of my heart was compensating for the hole. And we found out that I was going to be needing surgery through an X-ray that I had for my back since I have scoliosis. And the radiologist noticed that the heart was enlarged, and this was caused by my heart overworking since it had to compensate for the hole in my heart. So in October of 2020, they diagnosed me with the sinus venosus ASD, and they let me know that I needed heart surgery. And luckily, we got to schedule it um, a couple months in the future, so we could do it at a time that was ideal in terms of where I would be in school and the soccer season, since I've always played soccer and I wanted to miss as little soccer as possible, since it's something I really enjoy doing. So obviously, I was nervous, I was scared, but really, this is the first thing I would recommend is to just do whatever you can in the time leading up to your surgery to keep your mind off it and stay positive. For me, that meant just playing soccer and spending time with friends and family and just continuing my life as I would pretty much and trying just to focus on the day that you're in rather than the surgery coming up in order to avoid building up so much fear and stress about it. So what I would recommend is just trying to stay as positive as possible and know that this surgery is going to help you be better and healthier in the future. The next thing I would recommend related to the surgery is something called a meal train, which my aunt just posted something on Facebook pretty much explaining that I was getting the surgery and that my mom and dad were going to be having to deal with a lot of doctor's appointments and being in the hospital with me. So the meal train pretty much is just something where people in your community can sign up to bring you dinner some nights. And this was very helpful for my family because I have three siblings at home. So we ended up doing a meal train from January 4th, which was the day of my surgery in 2021, until the end of January. So in terms of time in the hospital, for me, I think this went pretty smoothly. My nurses and doctors were all great. Something that they're going to have you work on a lot is walking because that just helps drain fluid out of your chest and prevents fluid from building up around the heart, which is a major concern after an open heart surgery. Um, and yes, there's a lot of pain, and obviously on your sternum, and with the chest tubes, it can sometimes be painful to breathe. But again, it's just something that you have to work through. And so luckily, I mean, that really doesn't last too long, and the pain medications really do help. But walking, I think, was going very well for me, and it was also fun because it's something that you can challenge yourself with and try to walk further or faster or whatever, and just again start improving every day in the process of recovery. And then another thing in the hospital that I was definitely thinking about before is the food situation. Um, I thought that the food was pretty good. I guess a lot of people would probably disagree with me, but how they did it at my hospital at least is you just order on like the TV in your room and they bring it around at a certain time. I thought the situation was pretty good overall with food. And then moving on to more medical stuff, I had x-rays every day and scans on my heart to make sure that everything was healing in a way that they thought was good and healthy. And then one of the big things I was worried about is getting my chest tubes pulled out, just because it I know the thought of it is so weird that there's like a tube in your stomach that they're just going to pull out. And I built up so much stress and fear about getting my chest tubes pulled out, but it really took like 2 seconds and it's no big deal. There really is no pain. And then in terms of passing time in the hospital, because, for me it was 4 days, but it can be up to a week, I guess. And something that really helped me was just FaceTiming family and friends because obviously it just takes your mind off the hospital and the situation. This was one of my favorite ways to kill time as well, as watching TV in the hospital room or playing cards with my mom. Really anything to pass the time. Another thing I wanted to talk about was like my hospital timeline. So pretty much the day of my surgery, I was unconscious for the whole day because of anesthesia. I woke up a few times throughout that night, but really I wasn't fully conscious until the next morning. And to be honest, I was nauseous, but that nausea only lasted until about, lunchtime on the day after my surgery. So that isn't something I would be too worried about. And then I got my chest tubes taken out the day after that. So day 3, I got my chest tubes taken out and I was moved to a non ICU floor. And from there, you just keep walking and keep passing the time. You get monitored for a few more days. And I had my surgery on a Monday, and that Thursday, I got to leave the hospital after working with a physical therapist just so we could be safe about going upstairs and showering when I got home because you need to be careful to avoid any falls since that would put a lot of stress on your sternum, which is obviously not something you want when it's recovering from being broken during the surgery. So when I got home, the main things I think that you should think about are medications and walking, because walking is one of the few things you can do to really stay active. And for me, it was something great that I could clear my head with and just get fresh air. And then medications, because for me personally, I had never been on prescription medicine. So to have to take medication, every day at certain times, and when I first got out of the hospital, it was a lot of pills. So that was something that I would recommend setting reminders on your phone for. And I would recommend getting a pill box because I think that was very helpful. So for 6 weeks after the surgery, I could have no intense exercise. So for those 6 weeks, really, I was walking pretty much constantly from from the day I got home to the end of January. I ended up walking 100 miles. I just thought this was a great way kind of to stay fit for soccer, to make my recovery back to soccer as easy as possible, and also to get to enjoy myself and get outside because really, you can't really play sports and you can't hang out with friends as much. So this was a great way for me to just get outside and get to feel like myself again. And then, obviously you keep progressing. And after 6 weeks, I could go back to playing soccer without contact. What I experience is that you'll actually be better and that exercise becomes easier because there's a lot of stress off your heart that is taken off and you just feel better, like less fatigued. You have more energy. And I'm really glad that the surgery worked out the way it did and that they found my condition. And so, finally, 8 weeks after the surgery, I could go back to no restrictions. And the transition back to soccer was smooth. I think because I did so much work with jogging or walking and just trying to do as much as I could. So if you're an athlete, I would definitely recommend trying to stay moving however you can. So finally, just to sum things up, things I would definitely recommend are the meal train and walking a lot when you get home from surgery and when you're in the hospital, walking as much as you can and staying positive and keeping your mind off the surgery in any way you can, whether that be video games or spending time with family and friends, but just trying to keep your mind off it. But yeah, I just wanted to thank you for your time for listening, and I hope that maybe you can take something away from this video. And just for some words of encouragement, the surgery, the doctors know what they're doing and they're very experienced, and I just know that everything's going to work out. and that you'll come back better and happier than you were before the surgery. And even though it may seem scary now, and you may be feeling like, why did this have to happen to me? Which I was definitely feeling some of when I first found out I was needing surgery. Um, Everything's going to work out. And in the end, I hope you'll be happy you got the surgery like I am now.